Hallo, assalamu alaikum, good morning, khush amdeed, ji aya nu, goeiemorgen.
Pakhair agale, ni hao, tuna shumme, washmale, Ohio gozaimasu, guten morgen, hola, bonjour, privyet, kaifahal, hale shuma chotore, ahlan wasalan, marhaba, buna, mucho, gracias, swabiab, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning on the 4th day of Eid. Hello Shiza, how are you today?
I'm absolutely great, but is there really a fourth day of Eid though?
Well, you know what? I just want the festivities to continue for
Oh,
the rest of
okay.
my life. So this is how I'm actually going to assume. So probably next year when Eid's going to come, so I'll be like, ladies and gentlemen, after 365 days of Eid, we once again have a complete year of Eid as well. But we definitely
Yeah.
hope, ladies and gentlemen, that everybody out there is doing perfectly fine. But today, the kind of topic that we have picked up on, I think, is going to help all of those people who, first of all, are obese, or probably have got some problems because of the fact that they couldn't control their hands to stuff them and that into their mouth all the mutton and the beef that they are having.
Yeah, I'm guilty as charged, to be honest. I'm probably one of them because, first of all, it was Eid, of course.
Yeah.
You are not supposed to stop yourself. But then again, after the 3 days, you're supposed to get back to your normal routine. But Shazad, you
Yep.
mentioned that you absolutely love festivities.
Yep.
How come you're dressed so casual today?
Oh yeah, there's a reason for that.
Okay.
So, for all of the 3 days that we've actually done the show for Eid,
Yeah.
the previous 3 days, and everybody has loved it. Thank you very much for the feedback as
Yes.
well. So today was the day where I thought that, okay, the festivity should continue, but then at the same time, we should actually feel fit as well.
that's
So what I
true.
did was that, when you wear a jeans or a t-shirt, you know that you're more kind of, I mean, there's agility in you,
Yeah,
and, you want to move around. When you're wearing a suit, pant and coat, you just have to
You're really
sit down wherever
uptight
you are.
and-
Yes, yes. So that's why. So that's why I just chose to wear jeans as well, and I wanted to be out there on the roads doing something, which is
Okay.
why right after the show, I'm actually going for a hike too as well. I've got my hiking shoes in the
Wow.
car. But then other than that, ladies and gentlemen, I think that it is our responsibility over here to let people know that what are the kind of dangers involved if you eat quite a lot of mutton and beef. And nobody ever
Absolutely.
knew that there can be dangers involved if you ate a lot of mutton or beef.
I mean,
Yeah.
definitely there are. I mean, first of all,
Yep.
if you overdose in anything, there's going to be dangerous.
Yeah.
And a lot of Pakistanis especially do overdose. I'm using the word.
But can
because
you
they really-
technically overdose over mutton or beef?
I think yes. I mean, every other day you're going to dawats in Pakistan,
Yeah.
yeah? And then there are people coming over to your place. You really do have to cook stuff and offer to them. And while you are offering to them, there definitely you're going to, take your hands towards the food as well. I mean, that's what I do, and I'm pretty sure a lot of people do as well.
I'm very happy and surprised at the same time as well that a woman sitting right next to me over here in Pakistan is saying that she's all up for eating sacrificial meat.
Why
This
not?
is something which I don't get because I don't eat sacrificial meat. I
Oh.
mean, for that, I actually have to go to another shop, get some meat for myself, and then cook
Okay,
it.
you know what? This does make sense. Actually, a lot
go
of
ahead.
people remember in our Eid shows as well. People who came, they had sort of a cringe element for sacrificial meat. I don't know
Yeah.
why. If it's the smell, I don't know what it is.
There's a
but
reason
I'm
for
okay
that.
with it. I'm
yeah,
okay
there's
with
a
it.
reason for that because last year I think that I kind of found out the formula how you can actually get rid of the smell, and that is, ladies,
Oh.
it's simple. So once you slaughter the goat, after that, while they're taking the skin off, let the goat just hang. I mean, that's it. Just put
Okay.
a fan out there as well and let the blood drain. Let it be out there for an hour or two, and you will see that there won't be any smell anyways. Well, ladies and gentlemen, other than smell, there are bigger issues to resolve. So I think
absolutely.
we should actually delve into the kind of conversation which is actually going to be fruitful and helpful for all of those people who've actually eaten quite a lot in these previous days. Yes. So on my right hand side, ladies and gentlemen, we've actually been joined by somebody who's a dietitian. She is a nutritionist herself. She's none other than Dr. Nausheen Abbas. Hello, assalamu alaikum. How are you?
Assalamu alaikum. How are you? Thank you so
Walaikum
much for
assalam.
inviting
You're absolutely
me.
perfect. Thank you very much for joining us, and that too on the 4th day of Eid.
Yes.
Yeah, the Eid will continue, ladies and gentlemen. Alongside Dr. Nausheen, ladies and gentlemen, the gentleman whom I'm going to introduce, I think is one of those people whom I look forward to as in how to dress up. I think
Oh.
he's a great guy, and obviously the kind of work he does is great too as well. Great personality. I see him on different occasions. We even met in hospital car parks as well. We've met in different spots and places, but he knows what he's doing, and I think that he's one of the finest cardiologists over here in Pakistan, and people know him all over the world as well. Ladies and gentlemen, he's none other than Dr. Amjad Bhatt Saab. Hello, sir. Assalamu alaikum. How are you?
I'm fine, thank you.
Thank you very much for joining us. It's wonderful to have you. And last but not the least, ladies and gentlemen, for all the meat we consume, it can be undercooked at times. They can be, you usually go to different restaurants and you post these pictures where there's a little bit of blood on steaks too as well. Do you think that it can be injurious to your health? Well, I think so. And so, which is why we have actually invited somebody who's actually going to let us know about what kind of infections you can probably get eating undercooked kind of meat or the meat which is not really proper to eat. I think this is something to sum it up. This is the nutshell. She's none other than Dr. Naseem Akhtar. Hello, ma'am. Assalamu alaikum. Thank you very much for joining us.
Walaikum assalam. Thank you so much.
And
for
thank you very
inviting
much.
us.
And once again, everybody, a very happy Eid Mubarak. You know, we never got a chance to congratulate or to kind of send our wishes your way, which is why we kind of invited you today, so that we can talk about all of these issues. So, with Dr. Naseem, we're going to get started with you. Okay, so we all know that Eid is that time of year where everybody just wants to eat. They want to make sure that they're just eating all day long. And Pakistanis, even other than that, do not have a discipline in eating. I mean, they can have 6 meals a day, 7 meals a day, or not even a single meal a day.
Oh,
You're
yeah.
so right. You can say we are a kind of extremist when it comes to the food, right? Either we'll eat or either we'll just not eat. No?
Because that's the only
starve,
entertainment
Literally
we have in
starve,
Pakistan.
Exactly.
That's what they say.
Unfortunately,
Oh, yeah.
that's so right. We have. So the thing is, you have to be really careful, keeping in view. Other than if you're not hypertensive, either you don't have any diabetes or anything other than that, but still you have to take balanced amount of food, balanced amount of meat, and as well as balanced amount of sugar at this time of period, because festivities are continuing. You know, there are dinners and lunches, and you know it's all about food all the time. So if you're, God forbid, hypertensive, you have to take care of the thing that the red meat is really harmful in that case. And I'm sure you must have heard that kaleji, the liver has to be it has
Needs to be there on the table at 12 noon. Yeah,
yes,
that's it.
yes. The moment the animal is being slaughtered, they looking forward to have liver. So one has to be really careful because the level of cholesterol in liver is really high.
It's sort of an appetizer, right, for all the Pakistani
I wonder
families
how
out there.
that can be an appetizer, but people do take it as an appetizer. So that's the thing. And again, we have, mashallah, infectious disease control Dr. Saiba with her. She'll be telling us that how the more we are, the more quickly we're in a process of getting food cooked and eating it, that's the more
No,
different.
but before we move on to them, you know, there's one simple question which we need to ask. We were talking in terms of amount. What amount of mutton or beef do you think that an individual should consume over 3 days period of time? I mean, it can vary from individual to individual, I know, but if we make a generic statement, what do you think it should be?
Well, the meat is protein, and protein come to the
I love
technical.
it.
The technical part is like 0.8 grams to 1.5 gram per kg of the body weight. That's the technical
For
calculation.
somebody who's 100 kilos?
Somebody who's 100 kilos, so like it's 100 grams of protein.
Okay.
Right? So you have to, like 1.5, you can make it 150
Yeah.
this way. But
Alright.
now this comes, then the 150 grams of proteins is like a really small amount of beef. Like this is your palm size and it's equivalent to 100 grams,
In a
right?
day's time.
So if you are supposed to have 150 grams of protein at one time period, so it will be like this size of
So what, you
protein.
want us to eat dal on a barbecue? Well,
Well,
give us a solution too as well.
You can have, again, you can add some, add something salads and add some vegetables. Yes,
Even
yes,
on
yes.
Bakra Eid,
No,
we have
but
yeah.
vegetables.
So here's the thing, Dr. Naseem, you being a nutritionist, you know, you're a super, we can call you a control freak when it comes to food, right? Of course, you being a cardiologist, and ma'am, you also, you know, knowing all of these things, does it get boring for your family members when you sort of put a control on them, especially on days like Eid?
Well, it does
Yeah.
actually. It does. You know, you've been telling your parents that, you know, for my parents, they're hypertensive or diabetic also. Please control your hand. Please, we're not going to have this. They're like, eat hai, let us eat, you know.
Exactly.
This is the major feedback we get, but again, we're doctors, we're supposed to tell them.
All right. So let's move on to Barsa. So, sir, first of all, we actually want to know how were your first 3 days of Eid? Where did you spend your Eid? And now that you're back, we will move on with the question. But first of all, how was your Eid, sir? Okay, I think that, you know, I probably need to move on to my question, ladies and gentlemen.
Yeah.
And there's a reason for that which we cannot share. So if you want to know the reason, write to us on our Facebook page, which we'll give towards the end. So, sir, talking about consuming a lot of mutton and beef, first of all, what do you think that for all of those people with heart diseases really need to be careful about?
Hello, everyone, and we have talked on this was Deadly Quartet. You remember very well.
Yeah.
We talked on, as we're going to come back
Yeah.
to that. Any invasion of your body is harmful.
Okay.
Let me put it straight. And she knows much better than me. और आपने भी जिक्र किया दाल का.
Yes, sir.
Dal is a poor man's protein.
Yes, I know.
It is. It is.
So why you don't want to mix dal and meat?
Because
Oh,
we eat
that's-
dal. I mean, I'm a poor man. That's why I have protein every day in that form. Yeah.
So in my practice, I tell you, I don't restrict people.
Okay.
I tell them God has given you a big box up there. All patients ask me, my first answer to them is read your Nabi's life.
Yeah.
We can't do that, but we can follow that as a guide.
Yes, sir.
Because limitations are the rule for your well-being.
All right.
So I really don't want people to become a robot.
Yes.
That's a mechanical paper, put on the fridge and follow. You can't do that.
Exactly.
Because patient is going to cheat.
Yeah.
I always tell them, let's have supervised cheating.
Okay.
Because I tell them, go today after angioplasty. For example, yesterday, I put 2 stents and I said, go home and buy some payas and the nahari. But eat only a little bit.
Yeah. But why do you think that the payas or niharis are actually dangerous for people with heart diseases? Is it cholesterol?
Because what is in it?
Okay.
The way we cook,
Okay.
and then way we indulge.
Okay.
किसने एक लेके बंद करना है?
ये तो है.
Look at yourself. Will you? You will
I
not.
won't, because I want to grow my muscles,
course,
right?
of
Yeah,
course.
There's a reason.
So anything which is, if once you indulge,
Yes.
that's harmful.
Exactly.
Trust me, if you go all over the world,
Yeah.
United States, where I practice all my life, people eat way more than us.
Yeah.
You will not believe when you go conferences. It's like this. The plate is like this, and they're sitting, and the food is coming from both sides.
Yeah.
They eat worse than us.
I know.
But the problem is the lifestyle and the amenities they have,
Exactly.
and then the medical care they have, the education they have. It's a multifactorial. Your life is a multifactorial. You cannot encompass only with one factor, and you can say, fine, that's what we have to do. You have to make sure that you have education, you have information, you have a provision of the health care,
Yeah.
and then, of course, you can afford better food.
Exactly.
If you have somebody send you a meat from, surplus, and then you're putting in there, you don't have fridge.
Yeah.
It's sitting there. And that's how we can tell you what will happen to that meat.
Exactly.
Particularly. So these are the factors. Otherwise, I really don't go the strict rules what a nutritionist will go.
Yeah.
As a cardiologist, I know that eating meat or even eating your roti, your bread, that's as dangerous.
Yeah.
6 रोटियां रख लियां तो सब
So what you're trying to say over here is that one should never actually check the depth of the river with both the legs. I mean, if you want to feel the leg or the water, just put one in.
Just dip in.
That's how it is. That's great. But sir, very quickly, I might just kind of diverge from the original topic, but I just wanted to know, because I think that it is of imperative importance as well, that I think 3 or 4 days ago, I actually had to rush my father to the hospital. He had a muscle spasm somewhere here, and he thought that it was something which has to do with the heart. And there's been a cardiologist on our show who said that just take a Disprin and an Injicid, and God forbid if it's anything which has to do with a heart attack, I think it will buy you time. But the moment when we reached the hospital, my father has taken Injicid so far. I mean, I think that's the name of the medicine. The doctor over there said that not for all heart attacks you can take Injicid, and that there has to be different medication for that. And I was so worried then that God forbid if it would have been a situation like that, the doctor who's actually been previously on the show has dismayed quite a lot of our viewers as well. So please, can you elaborate upon that?
I do disagree with that. And the second doctor.
Yeah.
Angie said aspirin.
Yes.
A good move.
Okay.
But they have to tell that person also, don't take Angisid while you're standing.
Okay.
The precipitous drop in your blood pressure will kill you.
All right.
Because one Angisid, it bypasses your liver and all that. It goes directly where it should work.
Okay.
And the blood pressure will drop.
All right.
And many people, so the standing instructions are, take it when you're either sitting or you're in the bed.
Okay.
So the doctor is not telling you that.
Yeah.
Just take a Disprin and pop,
Yeah.
and you say it under your tongue, and next thing you're dropping dead. That's number one. Number two, and I'm glad you rushed your father to the hospital because heart kills.
Exactly.
Whenever I teach the juniors, I ask them one question. The new batch came, I say, what are 4, 5 things somebody comes with a chest pain you have to rule out?
Yeah.
It's not only the heart attack.
Okay.
when somebody comes into the emergency room with the pain, chest pain, MI, heart,
Yes.
aortic dissection, peptic ulcer, perforating peptic ulcer, pulmonary embolism, and pancreatitis. These are killers. So along with the education that if it's MI, we have to look into, but these 5 things are also killers.
Exactly.
So anybody so rushing to the hospital, that patient is very wise.
Thank you, Arun.
And take a Disprin at least, if not Angioset, because what are the mechanisms?
Exactly.
It's a platelet adhesion, binding of the platelet, which is sticky substance.
All right.
What Disprin is doing is blocking those platelets, so it may buy you some time. But just remember one thing, it's not going to work.
Okay.
Heart attack is a heart attack, particularly if it's a occlusive disease, and you have to salvage the muscle.
All right.
And the first hour is the key.
Okay.
Then it drops. Even you don't have an angio suite, and you can't take to the cath lab, what you have to do that SK, the thrombolytics,
Yes.
the clot busting medication. First hour is the key, because the muscle is still virgin.
Right, right.
For up till 4 hours is fine. After that, you are not doing any good to the muscle.
Okay.
And if you damage the muscle, you couldn't salvage the muscle, the battle is lost.
Okay.
All
So
right.
it's very important that we educate people. Do not wait, oh, it's a gas, oh, it's a rush.
Just go to the
Fine,
hospital.
prove it, expel the gas in the ER.
Exactly.
Not sitting home and waiting it will come out.
Thank you, Arun,
Absolutely.
for
Thank you
saying
so
that.
much for saying that, because, ladies and gentlemen, PTV is where we educate you. We love to do that, and we really love when you actually take something away from our
Yeah.
show. But moving on to you, ma'am, I feel like we should have actually called you before Eid, but okay, never too late. Were there any diseases among the cattle or among any sort of animals that were sacrificial that we should have been looking for while we were buying our animals?
Congo virus, I guess?
Yeah, I would like to highlight few things before going to the Congo virus actually, that there are particular diseases which are very much specific to the animals only.
Yes.
So we are very much fortunate that diseases which are prevalent among the animals, it is not always necessary that they are going to harm the human
Oh,
beings as
perfect.
well.
Okay, that's
so the
good news.
diseases which are transmitted from the animals to the human beings are called zoonotic diseases.
Right.
And there are quite few of them. And another thing which I want to highlight here is that it's not always that if we are using the undercooked meat and all that is going to cause some problem, but it is always, it can be either transmission through the ticks, which bite the animals and then they bite the human beings. And secondly, if you come in contact with the, blood or the meat or the or any other organ of the body of the animal which is diseased, it can cause the transmission of disease. And another thing is, if you are going to consume unpasteurized milk, even that is going to cause diseases which are prevalent in the animals, and they can cause illness in the human beings as well.
Okay,
And another thing which is also very important to share here is that there are few people in our population who are known as immunocompromised. They are more likely to get certain diseases which may not be going to cause any problem in those who are having a good immune system.
Okay.
So I would like to say that one thing that is the consumption of everything should be in moderation. And second thing which I would like to highlight is that hygiene is the first step.
Obviously, of
And
course.
whenever you are going to eat something, it should be well washed, especially if we are talking about the meat and mutton and all that, especially for these Eid days. You must wash the flesh of the animal very well, thoroughly, so that there is no obvious blood, and it should be well drained. And after
Right.
that, you must dry it, and then you must save it. And
okay.
another thing is, which I must say, that repeated freezing and defreezing
Yeah.
the meat is not a good habit.
Oh, it's a
You
bad
just
practice.
take
Okay.
it from the freezer, cook it, use it, and then it should not be like that you take whole meat from the freezer, you just keep it outside, and then you again refreeze it.
Yep.
It should
Oh,
not be
thank
like
you
that.
so much for saying that,
So-
because it's such a common practice. I mean, I've seen it happen among people in every other household.
Yeah.
Because even my
Because
mom.
there's not much space in the freezer.
No,
That's what you
like
get to hear.
literally, my mom even says कि गोश्त निकाल के रख दो बाहर, and then she will probably consume a bit of it and then put the rest of it back in the
Yeah,
freezer.
this should not
So,
be the
ladies
habit.
and gentlemen, it's not a good practice. It's unhealthy. It's unhygienic. So just take the amount that you really need to cook, and do not bother the other amount.
Exactly, that's great. And ladies and gentlemen, if you've got guests coming over, so I think that you should pretty much know the number of heads which are
Oh,
actually going
yeah.
to join you for dinner, and then plan your meal like that as well.
Shahzad, I think the best thing is keep in portions.
Yes, yes.
Small
Yeah,
portions.
of
That's
course.
what habit in Orange United States, what they do, they pack you in small packs.
Smaller
Exactly.
portion
Yeah.
will be had.
That's it. So you either get 2 packs out if there are like
Yeah.
10 people coming in, or one, or that's your choice.
Yeah.
But ma'am, very quickly, what I wanted to ask was that you've actually mentioned that there can be these reasons for anybody to get ill or sick within these days
Yeah.
because of the fact that everybody is busy sacrificing. What are the early symptoms of all of these diseases linked with the kind of facts that you've shared with all of us? For example, ticks and all of these problems.
Yeah, as far as the ticks are concerned, especially while you are going for buying the animals for the sacrifice purposes, one should be very careful while going there
Okay.
in the mandi
Yeah, yeah,
where
yeah.
the animals are there and the huge number of animals
all
are
the
there,
fun
you know.
is.
Yeah, and one must be careful by wearing light colored clothes. They must be, covering their legs by wearing the long pants and wearing full sleeves. And especially once they have brought the animal at home, I think everybody should not be coming in contact with the animals, because I know the children are very much fond of playing with the animals.
Right.
And
Out
they just
of
take
love,
them
they have-
out and, the animals might be carrying ticks on their body. So it is must for everyone to carefully watch and inspect the body of the animal if there are any ticks. So carefully remove them. Don't try to touch the ticks with the hands or without gloves, or don't try to crush them. And you can use insect repellents while going to the animal area,
Oh,
so
okay.
that you can
Yeah, and
avoid the
thank you
tick
very much for
bites.
saying, and ladies and gentlemen, please do not put the insect repellent on your goat or any animal. It's for you. Yeah, people need to be clear on this as well.
Yeah, there are specific chemicals which can be applied to the animal's body as well. These are called the acaricides, which can kill the ticks, and you can clean the animals without ticks.
I really hope the vendors actually
hope
do
it
have
is
that
not a
soap.
tick.
No, it's
No, it's not a tick.
It's
sir.
just
It's our
No,
pet.
but Shazad, you know what? I really hope that the vendors who are actually running the markets,
Yeah.
they would really be that educated, let's say, or that informed. I know.
They're not. They're
just
not.
say it. Just say
Because,
it.
ladies and gentlemen, just before Eid, 2 of the dentists were actually arrested because of the fact that they were giving fake implants to goats. So imagine, how
Wow.
good people are. So please don't say that.
Yeah, I don't even
because I do
expect-
not want to open up about it as well. But
Okay.
moving on to you now. So over here in Pakistan, we've got different cooking styles. Barbecue being one of them, and then we kind of want a lot of curry in it, and then we overcook things as well, and then we steam. And what is the best way to cook meat or beef or however, which you think is very healthy?
Well, Shahzad, if you'll ask me, I would definitely go for something which is grilled or barbecued. But again, it's the masses which we are catering. So again, if you're planning to make a nihari or a pie out of it, please use less oil, because that's something, the red meat, they are already rich in cholesterol. So if you're putting a lot of oil in it, you're just adding more calories to it, and they are not good for the people who have heart diseases or they have any other hypertension or anything like that. And as the Dr. Saib has also mentioned, the main thing I would mention here during this Eid and all that, we need to be really careful about our hygiene. The cooking time, the hygiene, our hygiene, and the area where the animals have been kept, that's very important. And show some patience and sabr ke saath. That's good. You're going to keep all the meat in your fridge and you're going to enjoy it rest of the 3 or 4 months, I'm sure. But still, add some, as Dr. Saab has mentioned, we can add some plant source proteins like the pulses or the legumes.
I mean, not on Bakra Eid at least, yeah. We do it throughout the year, Whenever you come on the show, you talk about all of these pulses. and
Well, how
whatnot.
you can eat just the meat for 3
Yes,
days? You
I
have
mean,
to
we
change
can
the
obviously
flavor.
have a little bit of onion or tomatoes alongside it, or potatoes.
But that's
probably.
mashed
essential
potato,
part
yeah.
anyway.
Yeah.
So you have to have a flavor, different
Yeah.
flavors.
Yeah, that's it.
So that you like starchy vegetables, we'll add non-starchy vegetables,
Okay.
but we'll make it more edible,
Yeah.
But since you mentioned that, how can we have meat for 3 straight days? But this is the fun of being
No,
in
okay,
Pakistan.
but
actually.
let me complete my thing.
Okay.
You can go with that too as well.
Okay.
The only reason why I was talking about potatoes or tomatoes or onion was because of the fact that, ladies and gentlemen, when you cook your meat, and that too in the same lamb's fat, the potato or the tomato or the onion tastes very nice.
Yeah.
But I think at the same time it is very injurious for health, because we're kind of intaking all of that fat which we kind of got from the goat as well. So do you
Right.
think that it's recommended or not?
Well, if you'll ask me, I think
बहुत
that
मजे का होता है
So now we have,
I
you
do
know,
that. You just put a portion of tomatoes on one side and potatoes on one side, and let it cook there.
Yeah.
So it will absorb all the flavor.
Exactly.
Right.
I think you can enjoy that, have lamb meat, but again, you have to be, you should know yourself. You need to know your body, your requirement. I don't want that you've been ending up emergency and, the whole Eid, the festivity is gone in one side and you've been looking for the medicines and the IV
Yeah.
drips and all that. That's for your betterment.
Right.
Of course, if you want to have lamb, have it. But as I mentioned, add some vegetables to it so that it's going to balance your diet.
Okay.
Nothing else.
All
Well,
right.
that's great.
But let me add some other dimension to it. Your cardiac disease is not a one-day business.
Yes,
Yeah.
absolutely.
So one-day food is not going to make difference. 3-day food is not going to make difference anyway. That's your continuation of the habits, which ultimately is going to get into you trouble.
All right.
So eating 1 day or 2 days or 3 days will not make any difference at all.
right.
Yes, if I do a testing, it may have a whitish on the tube,
Okay.
when I spin it. But otherwise, it's not going to add into the process of your coronary atherosclerosis, what we call.
Exactly.
That's a genetic factor. And for a long time, it's running for a long time
Yes.
before it will become obvious, become symptomatic.
Yep.
So I really don't think, but again, as you're saying, that those precautions need to be followed. But I don't think it makes much difference in your pathology. Let me put it this way. And, it will create a coronary disease all of a sudden, a heart attack all of a sudden. That's not going to happen.
Okay.
It doesn't happen that way. Coronary disease has a specific pattern.
So, ladies and gentlemen, what Dr. Saab over here is trying to imply is that, coronary diseases does not show up, just because you've eaten meat for like 2 or 3 days.
Not overnight.
Yeah, it's because of the fact that the kind of lifestyle you're actually enjoying, and it can be genetically as well, and then there can be other reasons. So for all of those people, I think, who've actually had meat and fine now, I think that you will be fine. But for all of those people
Absolutely.
who actually had this problem, I think that before eating anything or before going overboard, I think what you need to do is probably just get yourself checked up, because it's a very sneaky killer. I mean, all of these heart diseases, you never know what's going wrong.
Right.
People half of the time do confuse them with these gases, or tumhe gas ho gayi, ye ho gaya. But the best part is that if you think that there's a doubt, please make sure that you rush to the hospital. That's the best thing.
But the one thing is hypertensives.
Yes, sir.
But if you're eating a lot of salt in that, a lot of all the masalas, what we do, spices,
Yeah, sir.
that can exaggerate. That
Exactly.
can accelerate your blood pressure, and you might have. We recently have a patient, a young man, the blood pressure went to 200 and he has a bleed.
Oh, imagine
He has a
that.
surgery and then he's comatose.
Yeah.
So it can happen, but not the coronary disease what we are talking about.
Okay, so ladies and gentlemen, I think that the Dr. Saab was very loud and clear on that too as well, that if you're already hypertensive, please make sure not to consume quite a lot of salt. And that's true as well, because I've got quite a lot of family members who go through these problems, but one way or the other, I think that they're so educated that they already know what to do with their health. So please make sure that you do not put your health at risk. We have to go for a short break. Don't go anywhere. When you guys will be right back, we'll actually ask Dr. Naseem Akhtar about all of those goats which we buy not knowing that they were already ill, and what can they do to us. All right, so we're going for a short break. Don't go anywhere. Good morning.
Welcome back to Well This Morning, ladies and gentlemen, with Shahzad Khan and Shahzad Hashmi. And today I feel the show is important even more than...
Yeah, this goes on, ladies and gentlemen. It's not a problem because of the fact that it's a live show. It's the beauty of live show. Dr. Saab was getting a call.
No
Obviously, he's a
problem.
busy doctor, so, you know, everybody gets calls.
Right. So, ladies and gentlemen, for the past 3 days, we were discussing how festivities should go on, what we should eat. But today we are discussing what we shouldn't have eaten, actually, and what we should have, you know, sort of avoided. But now I need to move on to you, Dr. Saiba. You know, looking at all the things that we have already discussed, what do you think should be, I mean, in terms of lifestyle, one thing that we have established in the conversation over the break as well, in the show as well, in terms of the lifestyle, other than eat as well, what are the changes that one must adopt to be healthy?
Yeah, very good question. I must say that we all were talking about the moderation in our lifestyle. So that is very important. So eating less and walking more. And again, another message which I must convey is that we must try to keep stress out of our lives.
Okay.
So because stress is the main factor, and out of stress there are many people who eat more, and there are certain
easier
people
said than
who
done,
eat
I
less.
mean.
So although it's very difficult, but we can manage it, and we can try to be happy with little amount of money or whatever we have in our lives. We must be very much contented about that. And you know, eating less is very, very important, as we all are talking about. If you eat more and more and more, your digestive system is not going to handle it in a very effective manner.
Okay.
Because most of the patients who come to us after, especially after the Eid days, is because of the upper GI symptoms. They eat so much spicy food and they take so much junk food. In addition to taking the meat, they feel discomfort in the upper abdomen. They feel nausea. They have vomiting. They have diarrheal illnesses.
And even
So
irritation at
yeah,
times, you know,
irritation
they
at
have
times,
jalan gati.
and
Right.
and they feel that they have so much gases in their abdomen. So it is all because of the overeating practices. So it's not only the eat days. We are in the habit of taking too much food at all the times because we are busy. We take Coke, a burger, and things like that, and we just become indulge in our daily activities
and we
because of
don't
the
burn it
shortage of
off.
time.
We just keep-
And
Yeah.
similarly, the main problem is with our kids who go to the school. They are in the habit of taking junk food in their schools. So if you make a short survey at the schools, you would come across that most of the children are now in the phase of having obesity. So that is going to be a major factor in the future diseases like heart disease, hypertension, stroke, and all that. And another thing is that which I was talking about is well cooked food, well washed salads and fruits and vegetables. Are going to cause very few illnesses in the human beings, because we are talking about the diseases. One of them is very much common in these days is XDR salmonella. It is a multi-drug resistant organism which has emerged in our society just because of various factors. Number one is the overuse of antibiotics. And second is because of the contamination of the food and water and other things. It is because of basically poor hygienic conditions.
Right.
We are
At
not
homes as
taking
well,
care.
right?
Yeah. So majority of the diseases in Pakistan are basically because of poor hygienic conditions, which are either because of the poor water sanitation, the water which comes to our houses, and the second thing is that we are not well aware, or we are not bothered about that whether our water is boiled or not. Because just observing the water that it looks clean doesn't mean that it is free of bacteria.
Right.
So yeah. You
And
Thank you
should
very much for
be,
saying that.
Yeah,
boiling the water before using it, and you can observe it that the people who are using boiled water, they do not have much of the diseases.
Absolutely. You're actually exactly in line with one of the guests that we had here a few days ago. This was Hepatitis Day that we were observing. And he said the very same thing, ma'am, that, unhygienic foods, of course, when we talk about unhygienic food, you think about, going outside or from a restaurant, but you have no idea how many germs or how many, diseases you can get from within your house, of course, because of dirty water, but also, like you said, uncooked food like salads and whatnot. So you are generally transmitting your own germs and diseases to your family members. Please be clean.
Yeah. Ladies and gentlemen, आसान अल्फाज में गंदगी की वजह से हम लोग बीमार होते हैं. गंदगी को अपने
Yeah,
आप से दूर
repeated
रखिए.
hand washing is the key to health.
Exactly. That's great, ma'am. But very quickly, because we're very short of time as well, Dr. Saab, you mentioned about the coronary diseases, but all of a sudden, while we were on a break, you said that we really need to talk about strokes too as well, because they do not really give us any time to respond.
Right.
So how can we actually see a stroke coming?
But before that, let me know what Dr. said just is very good. but we also have to see our socioeconomic, factors.
problems, yes.
It's very good to say, do this, but can they afford it? Education is
Sir,
the key
hygiene
factor.
can be afforded.
Yeah,
I mean,
yeah,
I
just
don't
washing
think
your
that they can be
hands and
problems
Trust me,
with
cooking your
as
food.
those people who don't have two
Yeah, yeah, yeah.
piece of woods to boil the water, there are plenty.
Exactly.
But education is the key. If anything good can come out of your program, is a message: stop this. I don't want to call it damn fast food.
Okay.
Even in the United States, there were menus readdressed in children because obesity is the common problem and it's epidemic.
Yep.
I'm telling people, watch 15 years in your country because your country cannot afford what West can afford
Exactly.
to support the masses.
That's true.
Your health card,
Absolutely.
they don't even cover your basics.
Absolutely.
How you can cover the millions of obese people who are going to have all these problems we're talking about? So education is the key. And that is where the emphasis should come to the government.
Exactly.
Have these educational programs. So coming back to the stroke.
Yep.
Stroke is so devastating, depending what kind of stroke. You have a stroke, you don't even know. Like you have a mini heart attack, you don't even know. Many people come. But I see patients who are neurosurgeries with a bleed. So don't miss hypertension. Go to your doctor. That's why I'm emphasizing on education. Be aware, be educated. That's where you don't have to have any money.
Exactly.
To be aware and to be educated. All what you have to have 2 good ears.
Right, of course.
You don't have to have a cold, you don't have to have a gas, you don't have to have electric to boil the water.
Exactly.
But here, you already have 2 good ears. Listen to it and employ upon you and comply with that. So education and awareness is the key. Preventive medicine is the key in Pakistan. When I am teaching my residents, you know what I'm saying? Learn bedside medicine. We cannot afford an echo of 5,000 rupee, a stress test, an ultrasound, and this and that. You can't afford.
Yes, sir.
Because every patient is a pay-per-service. How they're going to have a $50,000, bill for 50,000 rupee just coming to the hospital and going out?
Exactly.
Step in, step out.
Yeah.
You have a 25 to 50,000 rupee bill.
Exactly.
So awareness and education is the key, no matter it's a nutrition, no matter it's infectious disease, no matter it's a coronary disease or stroke. Why you want to avoid blood pressure? If somebody's telling you, go to a doctor, stop eating. Who doesn't know not to eat salt when you have blood pressure? Everybody knows.
Right, that's basics.
Not to eat a big churi, a big pie, the balti of pie. Everybody knows.
Yes, sir.
That's exactly I used to tell my patients in States.
All right.
That's exactly what I'm doing. Choose this one,
Yep.
and you'll be just fine.
That's great. Thank you very much, Dr. Saab. It
My
was great.
pleasure.
And towards the end, if there's anything you want to say, please go ahead.
As a nutritionist, I always say that you are what you eat. So it's a practice, and you need to change your lifestyle. It's not about eating meat, or it's not about having loads of oil. It's about how you look into the picture, how do you perceive yourself and your health, and nothing is more important than your well-being.
Exactly.
So focus on your nutrition, and I'm sure that things can get better.
Amazing
Right.
that is.
Thank you
Thank you
so
very
much
much
for
for
saying
joining
that.
us. It was wonderful to have you, and it was beautiful, and the kind of conversation
Absolutely.
we have had. I think that it's going to benefit millions of people out there as
Right,
well.
most
But there's just
definitely.
one simple thing which I would love to mention over here. Ladies and gentlemen, I think the most common problem with Pakistanis is that they actually wait for something of such sort to happen and then go to the hospital and start crying all over again.
That's so true.
Whereas I think in the rest of the world, people go for regular
Regular
checkups
checkups.
and they get themselves checked up so that, God forbid, if there's something wrong, if there's something which is coming but you cannot see it, it can be treated in time and with lesser amount of money.
Absolutely, you're right, Shazad. And just one thing that we pointed out during the show, fast food. It is so important. I mean, as neglected as it does get, avoid fast food.
Yep.
First of all, it's not fast anymore. They take 10 to 15 minutes. But other than that, imagine 60+% of Pakistanis being the youth.
Yep.
And then later on, few years down the lane, we're looking at 60+% people who are obese because of the type of food that they ate. They don't have a healthy lifestyle. What are they going to do? How are they going to be productive?
Exactly. And for the last 4 months, ladies and gentlemen, I haven't eaten a single burger or a sandwich, imagine. So this is the kind of
Wow.
dedication you need if you want to be healthy and fit. And believe me, that in the last 4 or 5 months, since the time that I've started to work out, I have not even been ill for one single day. Shukr alhamdulillah.
Wow, wow,
I don't want to
mashallah, that's
jinx it too as well,
absolutely
yeah.
great.
Yeah.
So, ladies and gentlemen, if you learnt anything from us, or if you have questions, write on a Facebook page with the name of
Well, this morning.
on Twitter,
Well, this morning with Artie G.
Daily Motion on YouTube.
Well, this morning on Instagram, it's World_this morning, ladies and gentlemen. Do not forget to catch the repeat at 5 past 11 p.m. tonight. Till the next time, 1, 2, 3.
Good morning. Take care.
Thank you very much.